highlight that this session is going to be recorded. First of all, second of all, we are going to make the presentations available on the UNOOSA webpage. We would kindly ask you, if you have any questions, to put them in the chat. I, as a moderator, will be following the chat thoroughly, and I will pick the questions out and will address them to the presenters. My colleagues and I will be working on a short summary afterwards, so you will be also having the opportunity to have a written document about the webinar. We already had a very good first session today in the morning. This is going to be the second session. So some of you, I guess, will join for the second time. Some of you I welcome for the first time. Just as a short reminder, please turn off your microphones all the time, and also turn off the cameras. As for the presenters, we will be sharing the screen from UNOOSA side, and we'll click through the presentation. That's it from my side. Without further ado, knowing that we have a really interesting, packed agenda with different topics, I would like to give the word to our director, Ms. Simonetta Pippo, for some opening and welcoming remarks. Simonetta, the floor is yours.
Okay, so thank you, Marcus, and thank you, everyone. Good afternoon to everyone. And really, thank you very much for being with us today. Just a brief, let's say, introduction to this very interesting afternoon session. We are really experiencing an extraordinary situation with global implications, and seeking the right solutions exemplifies the need for multilateral action. COVID-19 has spread into every corner of our planet in just a few months and affected societies in their health, economy, tourism, culture, sports, everything. Among really, we could list, let's say, the number of areas affected for a long period of time. So it is now really when we truly recognize the vital role of science, technology, and innovation. And the value of space programs has manifested greatly during this pandemic. Enabling contact tracing and identifying affected areas through disease modeling, for example, and transmission monitoring, to remote work, telehealth and communication, and for one, on one side business, but also to be close to our friends and families. And these are just but few aspects where really space can play a crucial role. We at the United Nations Office for Outer Space Affairs, we assign therefore great importance to the availability of space benefits to everyone. While historically space activities were only affordable just for a few countries, access to space has changed dramatically in the last 10 years. But out of the 193 UN member states, only about 80 have ever had the satellite in orbit to date. We are still far from making the benefits of space universally available. So it is high time we ensure that space-based data and infrastructures are utilized to their maximum potential in all corners of the world. But what exactly must be done? I would like to highlight three words: partnerships, networking, and cooperation. UNOOSA has exemplified this approach exceptionally, I would say exceptionally well in the past few decades. And thanks to the great support of our partners, we have been able to make a real difference in the world. Bringing non-spacefaring nations into the space community, enabling students to turn their ideas into research, training individuals and teams to use satellites to save lives, improve food and water security, and accelerate global efforts towards sustainable development as such. And building on the success of past health-related activities, we have taken immediate steps to seek solutions and help the international community in addressing the COVID-19 crisis. A dedicated task force on Space4Health was established to improve inter-office coordination in developing concrete response to the novel needs. And to help bridge the information crisis, UNSPIDER compiled examples of contributions and best practices using space in addressing COVID-19. This helps to facilitate the discovery of solutions already developed and used by global space stakeholders. Today's webinar is also an integral part of an overall effort to harness the power of space to tackle the challenges of humanity. And in tackling COVID-19, let us use space not only in the current phase, but also in the recovery phase. The world we need to restart, and satellites will certainly have their say in not only returning the status quo, but in shaping a more livable and safer planet. What we need right now to foster innovation in combating global challenges is diversity and integrated efforts. I'm therefore excited to have with us for this webinar a nice variety of speakers with different backgrounds and stories. In the next hours or so, we are going to listen to different perspectives on the work that has been done by different stakeholders. We are going to delve into the specific role of UNOOSA as well as activities of the international space community. I'm really looking forward to your interventions, and I would like to thank you all for your contributions. And as we said, the three key words are partnership, networking, and cooperation. Thank you very much.
Thank you very much, Director. Thank you very much for these opening words. Piggybacking on what the Director just said, partnership, networking, and cooperation is at the center of the global reply to our current challenges. And as such, it's a pleasure for me to give you the word to Mr. Antoine Geissbühler as chair of the working group on space and global health. Just as a short reminder, as a moderator, I will take the liberty to remind you if the time is going to be up, and going to give you a short signal if your time is going to an end. So without further ado, Mr. Geissbühler, the floor is yours.
Thank you so much. And as a Swiss citizen, I hope I'll manage the timing properly. Would you mind skipping to slide number 5? The other slides are really here for context and historical and sort of conceptual context, and will be obviously attached to the minutes. So it's the slide after this one. One more. Thank you so much. So yeah, it's my pleasure to present to you the work of the Scientific and Technical Subcommittee Working Group on Space and Global Health, which was established in 2018. Obviously, this is not the first time that there are discussions about the connection between space technologies and global health. Actually, this work started way back in at least in 2001 with a focus on public health and has been evolving since. But it's now a formal working group of STSC, and as the director explained, we currently have a very good example of a global health challenge, a global health crisis, and that helps us question and frame the discussions on the challenges and the possibilities that space technologies can provide. I'm a practitioner of telemedicine and digital medicine, and I can tell you that over the last 2 months we've made huge use and progress in the deployment of those technologies, because they really bring solutions to the current crisis. And so the domains that we are working on when we talk about space and global health are really domains around telemedicine, about telehealth, about teleepidemiology and environmental health, but also around disaster and health emergency management, as well as space life sciences. So this is sort of the domain of our interest. And what we're trying to understand is how the technologies that come from space research and development, including remote sensing, including telecommunications, including navigation support systems, and obviously space technology development, can actually increase our ability to respond to global health. Now, we have established this working group and have come up with a multi-year work plan, which really started last year on agreeing on the methods of work. And based on preparatory work, we realized that we really needed to have much more input from the member states and developed a questionnaire which has been sent to the member states and to various agencies for comment and for giving us input. And the kind of input that we are seeking is really about the connection at the national level between the space sector and the health sector. It's about capacity building in this domain. It's about what are the projects that are going on in the different domains, telemedicine, telehealth, epidemiology, health emergency management, and space and life sciences. And the idea is that we will collect this information, try to understand where are the resources, where are the gaps, where are the best practices, and make sure that we can facilitate the sharing of this information, the sharing of the tools, the sharing of the capacity building resources in this area. And that has been a request by many of the experts, but also many of the member states that we've been in contact with. There is a lot of knowledge, there is a lot of things going on, there is still not enough ability to share and to connect those experiences, those expertises, so that everyone can benefit from this. So we have developed a number of tools. The questionnaire is the main tool. We also have an open wiki that is used to gather information and to try to collect as much information as we can, including open educational resources on space and global health. And this is done with the support of the University of Koblenz-Landau in Germany. We at the last meeting in 2020, we requested that the Secretariat, the UNOOSA, would send a letter to the WHO to inform on the work of the working group and to continue invite responses by the member states and other parties to the questionnaire, but also to nominate points of contact so that we could then, on the basis of the information collected, go deeper and collect additional information. We also want to have more public health and medical experts included in the delegations that meet at the Scientific and Technical Subcommittee in order to facilitate those contacts with the space experts. And one of our goals during the ongoing year is really to prepare recommendations to provide a globally accessible platform that would enable all the knowledge that we're collecting to be connected, made available, but also made searchable in such a way that it can actually provide responses to the participants and in this community. One of the things that obviously is on our mind and on many people's mind is try to understand how what we are doing can bring solutions, but also bring learning from the COVID crisis. And so in June, we will organize another virtual meeting that will specifically focus on space, global health, and lessons learned from the COVID-19 pandemic. And hopefully, as Director Simonetta Di Pippo mentioned, also be useful in the recovery crisis phase of the crisis. So this is sort of where we are. Hopefully you get a better understanding of our activities, and I think with this I've come to the end of my time and look forward to further presentation, discussions, and exchanges. Thank you so much, and thank you, Chair, for the opportunity.
Thank you, Dr. Geissbühler. Thanks a lot for your overview of what the international community is doing under the framework of the committee and the working group on global health. I just want to welcome those who have just joined recently. Just a short reminder, please turn off your mics and your cameras. And also to encourage you to post any questions within the chat. I will be monitoring the chat throughout the entire webinar, and I will pick out the questions you might have. There's also an opportunity to like questions within the chat. So if you see one question which you would really like to have answered, please feel free to click on the like button, and I will monitor that as well. Having said that, we have now heard more from the member states within Copus. I now ask my colleague Jorge del Rio Vera to start off to give you a bit of an overview about the work of space and global health within the Office for Outer Space Affairs. Jorge, the floor is yours.
Thank you very much, Marcus. Good afternoon, everybody from here from Vienna. I'm Jorge del Rio Vera. I work for the Space Applications section in the Office for Outer Space Affairs, as Marcus said, and I want to give you an overview of what the space can actually do for health, or what a space can teach us about for health. We have to bear in mind, and we don't have to be naive, space is one of the many tools that we can use, and that tool can work much better if combined with others. It's very often overlooked. I mean, if you are thinking about the navigator that you have in your car, you are not thinking about an infrastructure that is composed of 4 constellations of satellites that are orbiting the Earth in mid-Earth orbit, and that are all intercompatible and are compatible and interoperable. So you are not thinking about that. You just want to go from point A to point B. You are not thinking about the space. So I want to give you some pills of what a space can do, and we are not thinking about that these days. So if you go to the next slide, please. For instance, you may think that the astronauts in the International Space Station or experiments in microgravity may not have anything to do with health, but actually it is quite the contrary. Microgravity offers a unique environment where you can do things that you cannot do on Earth, and you can learn things that you otherwise would have much more difficulties to do on Earth. For instance, it is very much possible to grow proteins in space. The way proteins are growing in space is a little bit different. They grow more in a 3D structure, and they grow bigger, better ordered than on Earth. On Earth, they are constrained by the gravity force that is pushing them downwards, and they are more constrained to grow into a 2D configuration. So having this advantage of having a better growth protein, which is a little bit unfolded, you can actually understand better how the protein may react to certain drugs that you might be developing, or why is reacting in a way that is reacting to certain drugs that you are using to try to tackle diseases on Earth. So it is very important that the fundamental research that is carried out in space and also in facilities on Earth. I mean, you can carry out some smaller scale experiments in drop towers. For instance, UNOOSA has a partnership with ZARM in Bremen to utilize the drop tower that they have there to have microgravity for 4.5 to 9 seconds, depending on the configuration, where you can do a certain number of experiments in biology. We also have a partnership with the Chinese Manned Space Agency to utilize the Chinese space station and also do microgravity research. And we selected some proposals that are indeed related to biology. Another thing that you may get from space is how are astronauts being treated when they are up there? Are there any physicians? Well, the answer is normally no. I mean, often the crews that are deployed don't have a physician with them. And actually what astronauts do to cover that lack of physicians there is preparedness. They get trained into basic medical skills so they can treat themselves. It's part of the basic training and advanced training modules that they get during the training before a mission. They are also getting training on the equipment that they may be using to actually discover diseases. They have, for instance, ecography on board the International Space Station where they can do ecography on themselves. And actually, thanks to this equipment and the training they got, one of the astronauts discovered a blood clot in his neck. And he was treating himself with the support of experts in ground. So don't underestimate what a person can do with the adequate training and equipment and the support of remote experts. So the so-called telemedicine. Can you go to the next one, please? Next one, please. Thank you. Other things that we can get from space is to get information about how a virus or a disease spreads, and also how, if we are imposing some certain measures, like the lockdown situation that some of the countries are putting forward now, are impacting the behaviors of people. So you can actually tackle and target policy better. So, for instance, in the slide that you have on the screen, you can see the impact of the lockdown in a country, taken from mobility data. Mobility data was provided on the left side by Apple and on the right side by Google, and you can find this data online. There are many ways to get positioning data, so where a person is. One of them is GNSS, and the International Committee on GNSS is supporting that these measurements that we are getting from GNSS are better, because the systems that are there, thanks to the discussions that are happening between the different providers, are interoperable. So we can combine different measurements to get more accurate positions. There are also discussion on the environmental factors, and you will get a lot of presentations on that today. There is a lot of research going on whether temperature, humidity, UV radiation are affecting actually the spread of the disease, or how much the disease can be contagious. Those research are going on, and there are discussions happening in the group on Earth observations, community of practice on health, which is another forum where I'm attending. We have members here today, so that they can also talk a little bit about that. And these environmental factors can be extracted from satellites that are looking down the Earth, which are very important. They are revealing those factors. We are very proud that we are helping developing countries to put their own satellites in orbit to track issues that can affect global health. For instance, like 3 weeks ago, thanks to a program that we have in cooperation with JAXA, the Japanese Aerospace Agency, Exploration Agency, which is called KiboCube, Guatemala put a satellite in orbit. The first satellite of Guatemala was put in orbit. And this satellite had a payload that is going to be measuring water quality, which is a very important piece of information if you are concerned about health. There are other things that you may want to consider. I mean, and especially when a disease like the COVID-19 is spreading, you may want to keep an eye on how other diseases are spreading, and also Earth observation can help there. Currently, there is an outbreak of dengue going on in some countries in Latin America, and telepidemiology, thanks to Earth observation data, it can be very helpful. Can you go to the next slide, please?
1 minute, please.
Yeah. So this is my final slide, and I'm happy that I'm making it on time. Microgravity research can help. I mean, think in a space as a toolbox that have many tools inside. Experimentation in microgravity can help understanding how biology is behaving in a way or another, and can help us to understand whether we can target a disease in a way or another, unveiling mechanisms that we cannot unveil here on Earth. Telemedicine infrastructure is better if it is coupled with training, and this training can also be delivered by distance learning. So space can also help there to deliver training on medicine. Space-based data can be part of the response, very integral part of the response. It's not only GNSS, it's not only Earth observation, it's the combination of the tools that is making the whole thing very powerful. And discussion that is happening in the ICG, in the International Committee on GNSS, or in the Committee on the Peaceful Use of Outer Space, like the presentation that we had before, are helping realizing the full potential of the technology. Also, conversations are happening in other forums, like the group on Earth observations are helping in realizing the power of Earth observation. Space is a tool, and it can be a very useful one, but it works much better in combination with others. And it's not a tool for everything. That's very important. Of course, if you have questions, you can count on the Office of Outer Space Affairs to provide support in identifying the base use that you can use of space technology data and services to tackle the particular problems that you may be having. And maybe space is not the answer. Thank you very much.
Thank you very much, Jorge. So we started off hearing the background about what the international community is doing. We have now delved into what space can do on a very broad sense in the support of health. And now we hear a very specific example from the Office for Outer Space Affairs from one of our programs, which is the UN Spider program. And I kindly ask Radu to give us a bit of a background what UN Spider is doing under their program. Radu, the floor is yours.
Thank you, Marcus. So, good afternoon, everyone. As we're waiting to, yeah, that is great. Good afternoon, everyone. My name is Radu Botez. I'm based in the Bonn office of the Office for the Space Affairs. And as Marcus said, I am working on the UN Spider program, which is implemented by the office. UN Spider is the United Nations platform for space-based information for disaster management and emergency response. Next slide, please. So UN Spider was set up in 2006 by the United Nations General Assembly as a program of the Office for the Space Affairs. And just to give you a quick overview of our mandate, I've highlighted this paragraph, which states UN Spider aims to provide universal access to all countries and all relevant international and regional organizations to all types of space-based information and services relevant to disaster management to support the full disaster management cycle. And here I would like to highlight two elements. One is that we are indeed looking at all types of space-based information, Earth observation, telecommunications, as well as other technologies. And we're also looking at the entire disaster management cycle, which means that on the one hand, there's preparedness, prevention, and so on. And on the other hand, emergency response and reconstruction after a disaster. And UN Spider is working primarily with developing countries around the world. We are supported by a large network of regional support offices that are helping us in implementing our mandate, some of which also have participated in this webinar session. Next slide, please. UN Spider's activities fall, roughly speaking, into four areas. So technical advisory support really is at the heart of what we're doing. We're working with countries in supporting them to make use of space technologies, of all types of space technologies for the full disaster management cycle. And the way we do this is typically through so-called technical advisory missions as a first step, where we would speak to different stakeholders, primarily in civil protection, but also in other institutions in the countries, to understand a bit how space technologies and also geospatial technologies are used currently, and to see a bit what the potential is to further institutionalize the use of these technologies so that the country is better prepared for disasters, can respond more effectively, and so on. Based on the insights we gained, then we really come up with very customized capacity building activities. These are usually centering around what we refer to as recommended practices, which are step-by-step procedures for downloading, processing, and mapping space-based data. And these procedures, these recommended practices, address a wide range of hazards, from floods to droughts to forest fires. And they also address different phases of the disaster management cycle. So we are training stakeholders, we are training disaster management agencies in doing flood hazard maps, as well as maps of flood extents and damage assessments. So it's really, again, covering all phases. And we are providing the support online and offline. One way we do it online is through the knowledge portal, which is really at the heart of our knowledge management efforts. And knowledge management is the third pillar here. The knowledge portal provides a way to discover space-based information, to discover all the benefits of space technologies for disaster management. It is highlighting examples of the use, including right now on COVID-19, but it's also providing a way to find the data you're looking for, because we cut through the noise. We bring together what we think is useful for disaster managers that are looking at specific hazards, that are looking at specific phases of the disaster management cycle, and we make it easy to find that data. And then we provide these step-by-step procedures, which are typically in free and open source software that basically help people make use of the data to build information products. And finally, we bring together the space community and the disaster management community at regular conferences and expert meetings where they can exchange, so that we have a constant dialogue between providers of data and the end users in the field. Next slide, please. So for COVID-19, to support the response to the pandemic, we have basically focused on knowledge management. So we've tried early on to compile in a repository that you'll find online on our knowledge portal different examples of how space technologies, and again, we're looking at all space technologies, Earth observation, global navigation, satellite systems, telecommunications, how all of that has supported response to COVID-19, and you can filter, and that's again something that we have time and again seen for other disasters, is when we are in a crisis situation, there's a lot of information, and really knowledge management, making it easy to find relevant information becomes more important. So we're trying here to basically categorize a bit and make it easy to find relevant resources. And we're inviting everyone to submit examples. So if you have an example of the use of space technologies, please submit that through the form that you will find on the page, through which we have linked here. I'll also post the link in the chat in a bit. Thank you very much.
Thank you very much, Radu. So now we have gone from the very broad topic and have funneled down to our very specific UN Spider program. I would like to switch to the next session. So we are now having the first part of this webinar session is on space for emergency and health. I would like to thank all the speakers who were able to join us at such a short notice. Starting off, I would like to ask, I don't know who is going to present on behalf of e-Geos. It's either Ms. Luzietti, who I saw in the as a participant already, or Anna Laura Di Federico. So the floor is yours. Thank you very much.
Thank you, Lucia. In this case, Lucia Luzietti, thank you for giving us this opportunity to show some application from the Copernicus EMS Rapid Mapping Service. eHealth indeed is a leader of the consortium that is providing the Copernicus EMS Rapid Mapping Service. The main focus of this service is to provide geoinformation product based on satellite images in support to natural disaster, man-made disaster. So when there is an emergency, typically the user, when we receive a request inside Europe, are the European Civil Protection, but the service provide support also outside the Europe, thanks to the cooperation of the European Commission that can support local authority in case of an emergency outside the Europe. Please go on with the first slide. In the framework of this service, we provided some product for this ongoing emergency for the COVID-19. We have a standard portfolio because the emergency services is basically a 24/7 service, so the task is to provide as soon as possible the information based on the satellite acquisition to the user. But in this case, the user, and in this example, the Italian Civil Protection asked us to work on detailed cartographic product based on updated satellite images. This because especially for the plan of the phase 2, so after the lockdown, the user need to have an updated view of cities and its evolution in a short time. So we provided accurate measurement of open or closed spaces for the identification of the maximum capacity of spaces dedicated to public services and other relevant services for citizens. These products at the end are used by the authorized user for a correct plan of the next phase after the lockdown, also because they have the opportunity to integrate additional cartographic product and additional national geographic layer that are essential to extract information useful for a correct plan. Please go on. So for the phase 2, in this case, we provided this product focused on the extraction of the mobile and the temporary hospital infrastructure. This is important because the user have the opportunity to have over a big area of interest a continuous census of the installed infrastructure, and have also the opportunity to merge this information with population data to check actual level of users versus the expected and design for the phase 2. Another important feature that in this case the user, the civil protection, asked us to extract was the opening of the position and the right size of the street markets and the green areas and the parks, because all these areas were completely closed during the lockdown. So in order to have again accurate measurement of this specific area, we extracted this information from very high resolution optical data. And again, this is an opportunity to have this information in a short time to analyze and to add other layers and to useful for the planning phase. Please go on. This is another example of product that we provided during the lockdown. So a completely different analysis. And the focus of this product was the monitoring of the border area. Indeed, the lockdown within several European countries generated important traffic key at the border area. And for this reason, the European Commission asked us to provide a daily update of the traffic jam, jam over specific area, and the number of trucks versus the number of other type of vehicle. So this is another application completely different with respect to the previous one that we provided in support of the COVID-19 emergency. a similar analysis can be based also on SAR data. These different sensor type give the opportunity to have, for example, an update, two updates per date. So the possibility to have more monitoring if it is necessary, or to have information in case of cloud coverage. Please go on. This is a completely different application. So not for COVID-19, but for Ebola, that we provided in 2014 in support of the Ebola epidemic in Guinea. Again, the satellite images can be very useful to provide information in a short time to take decision and to understand, for example, where may be located the potential affected area. In this specific case, the main vector of the virus were bats, which dwell on oil palms, and the epidemiologist seek to identify the area of oil palm cultivation in order to locate area where potential patients may be. And for this reason, over the area of interest that we received, we extracted from, again, optical satellite images, detailed information of the palms cultivation, the scrub with the sparse palms, and the user used this data to understand the potential affected villages, and also to plan logistic and mission what was necessary to fight the Ebola in Guinea, inside this area. Please go on. And this is another application. We are again in Guinea for the Ebola crisis, but in the second phase. So some months later, the Belgium authorizer user was planning to send a medical mission to Guinea to support the country during the crisis. And the aim of the rapid mapping product was to map in advance, so before the mission, all the infrastructure and all the facility inside the area of interest in order to facilitate the logistic, the planning of the medical mission. And so the user requests to provide detailed information on the position of road, hydrological network, to know in advance any limitation in moving people or goods, the location of human settlement, and in this case we provided a very detailed reference product with the identification of all building and all building use. Again, this information is very important to map resources already available on the territory. Please go on.
1 minute, please.
Thank you. And this is the last example. It is a completely different application. Just to give again another example to stress the fact that the satellite images can be used to provide a very vast number of information. This is a product that we provided for the phytosanitary emergency in Italy due to the Xylella fastidiosa. So it is a bacterium, and during this emergency, due to the progressive spread of this bacterium, the Italian government decided to set up a special task force who worked on procedure and on activity to be finalized in the field in order to try to fight this emergency. And so in this specific case, the emergency plan foresees the eradication of all the plants potentially affected by the infection in order to create a phytosanitary barrier to stop its expansion. So we provided detailed analysis on the status of agriculture, mapping all eradicated olive tree, all eradicated fruit tree, and so. So again, the possibility to give an overview of a very big area of interest in a short time in support of decision and on a plan of activities to be completed in the field.
Thank you very much for this very useful overview. It's great to see from the need, the requests coming to the finalized product. So the full steps from the starting point to the end was very interesting to see, and thanks a lot for this very informative presentation. Next, I asked Professor James Hagen. He will give us a bit of an overview of space-related aspects of pandemics and diseases. So, Professor Hagen, the floor is yours.
Good afternoon, and thank you. I'm Jim Hagen. I am a microbiologist, public health administrator, and a disease manager. I'm here to speak to you for a few moments about the space-related aspects of disease and pandemics, specifically COVID-19. I live in Illinois, specifically Chicago, where there are 3,000 to over 4,000 new cases of COVID each day. I appreciate those that say we've been through this type of thing before and we have survived. Unfortunately, not all of us will survive, and especially those who are older or have additional vulnerabilities. Next slide. There is a long history in the peaceful uses of space concerning how space resources can be used to better human health and well-being. Here are just a few examples of current activities utilizing space technology. There have been some very interesting findings concerning how microgravity might affect cancer cells and development of tumors. As a microbiologist, I am well aware of the space technology as used to examine disease occurrence and prevalence of a wide range of microbial enemies, including malaria, measles, Ebola, Zika, and many others. Technology has been used to look at emergency services and examine where these services are used and most needed. Space technology has allowed us to optimize our use of UAVs and drones in disaster response and recovery. Most recently, and very importantly, is our current reliance on the internet and web technology. Telemedicine and telehealth have become the way that we now visit our doctors. In the United States, over 80% of the population now uses telemedicine. Last and very important to us today, remote sensing technologies can be used to examine disease patterns, explore environmental triggers for how diseases spread, and define environmental monitoring that will help predict disease occurrence and spread. Could it have predicted the rise of the novel coronavirus we now all face? Next slide. In today's world, we are faced with the global reality of the emergence of novel microorganisms, as well as the reemergence of age-old killers that have come back to haunt society. Our society is now older, heavily medicated, and that it has a multitude of comorbidities and chronic conditions. We have feared this the most. It is fertile ground for organisms that will take advantage of any deficiency. Having been in Wuhan and many other Chinese and Southeast Asian cities, I am well aware of the cultural differences that might lead to interspecies jumping of microorganisms. We have long known the intimate linkage between climate change, the environment, and the appearance of these novel microorganisms. Space technology has a long history of measuring a myriad of environmental factors that affect this relationship. What we need now is intelligent design and linking those measurable aspects of disease occurrence with the rise, progression, and resolution of disease. We live in an era of big data and AI, artificial intelligence. There are those who look at COVID-19 as a technology information problem. We need to know where COVID-19 is, who it affects, track those who are affected, and be able to track the serologic status of those who are infected and recover. Next slide, please. On this slide, I've placed just some of the factors that need to be measured, considered, and analyzed to help us better understand this virus and the viruses that will yet assail us. For example, we need to be able to track infected individuals by symptom and antigen status. We need to be able to do contact tracing on those individuals by geolocation. Where are the cases and deaths? We can track other things, as just shown, such as parking lots or modes of travel, to see what effect lockdowns, stay-at-home, and other public health actions are having. We are already utilizing the ubiquitous cell phone to help us understand the movement of people and their activities in these difficult times. Next slide. I know this is a complex graph. It is from a recent publication in the Journal of the American Medical Association, and I've placed the reference at the bottom. What it does is link together information about antigen status, antibody status, and the different types of tests as they relate to infection and infectivity over time. This is the type of data that needs to be linked together with the other environmental and population information available to us through space technology. Use of AI and big data sources will ultimately allow us a better understanding of this coronavirus as well as future coronavirus outbreaks. Our challenge is to integrate and correlate all of this information available through space sources to direct our actions to stop the virus. The key will be to rapidly locate hotspots of infection and take immediate appropriate attention and action to aggressively contain and put out the viral fires until a vaccine or effective antiviral agents become available. Technology will also be needed to then track the use and effectiveness of those antiviral agents and vaccines that are so desperately needed. We do have the space technology to help. Thank you for your time and attention.
Thank you very much, Professor Hagen, for this very, very broad overview, and you make my work a bit easier now because you addressed a lot of questions which have been posted in the chat already, and I guess this will trigger also some follow-up questions. As a next presenter, I expect also to be answered one of the questions which has also already been posted in the chat, which was on food security and insecurity, whether this can be assessed through space technology, and I kindly ask Mr. Talbot Brooks for his presentation. Maybe Mr. Brooks has some connecting problems at the moment. If Astrid wouldn't mind.
Sorry, Marcus.
Okay, perfect. The floor is yours.
Thank you. I appreciate the opportunity to be part of this meeting. It's very interesting. My name is Talbot Brooks, and I am the director for the Center for Interdisciplinary Geospatial Technologies at Delta State University in Cleveland, Mississippi, in the United States. Next slide, please. When we think about space-based observation systems as they relate to COVID, I tend to try to think of them in terms of geospatial intelligence. And I would define that as space-based systems that collect spatially referenced data that must then be analyzed, interpreted, and converted into context-relevant information that may be exploited for advantageous use to solve a problem. if you think about what that really means, there are several processes that must be connected end to end. The design of the satellite and the sensor system, its launch to space, its operation to make observations, the collection of data, etc. There are three pieces that I think in particular impact decision makers and everyday people that want to work with these data. And they extend beyond the technical domain. It's not the stuff of engineers and mathematicians. Rather, the first is the need for standards development processes that enable access and distribution of data. So in the COVID-19 outbreak scenario, there are lots of barriers to effective communication and data sharing because we haven't done a very good job standardizing. There are communication processes that have to help us how best communicate our spatially based information to audiences. And then lastly, we need to look at integrative processes that facilitate holistic approaches so that we can keep up with things like rising food insecurity or loss of capacity in the transportation sector. Next slide, please. So I'm going to dive into these three just briefly, more as suggestions or a call to those listening in to kind of think about. The first is data standards. Data standards cover a lot of things. It's about the exchange and transmission of the data. Do we do this in text or in XML or as a service? We must be able to assess the completeness, the quality of the data that we collect. Here in Mississippi, we may be using one set of parameters to define quality. It's only, say, COVID detection has to be by PCR, or could it be detected by PCR or a certain set, 3 of the symptoms, or antibody? We don't know right now because that's not how, we don't have a standard for that data necessarily very well defined. And it's got to be something that's got to be driven by the standards community and by the participants. Data standards are best accomplished when we use a consensus-driven approach. That way we tend to not leave something really important out of that standard as it gets developed. And certainly an important thing to do is identify the clearinghouses through which we can register and distribute standards for data collection, recognized authorities like ISO, and even hosts like WHO would be a really good place to start. And then a final component, as we develop these standards, you're going to publish them, but educational materials must penetrate out into the user community so that we understand what those standards are and how they're best applied. Next slide, please. So as I just kind of cruised around the internet over the last day or two, trying to look at what standards are out there, there are in fact standards. It's kind of like elbows. Everybody has an elbow, right? Choosing which one and understanding what it means, again, needs to be a consensus-driven process so that we move towards one framework for sharing information about this disease instead of 20. Next slide, please. Just another example of one of the standards and data packages that's in play right now for sharing COVID data. Next slide, please. And yet another one for the International Association of for Engineers. Next slide, please. So it's important that we're not setting competing standards, that we work together to identify one standard and use a consensus process. The next bit I wanted to address was communication and cognitive bias. You know, we think of maps as the basis for how we communicate satellite data, and really they're spatially referenced pictures. We tend to have a certain message in our heads as the map creators, and we're trying to use that map as a communication device to send that message to a user. Unfortunately, both our perception of the data that we receive and how the product that we create is interpreted are subject to cognitive biases. These are things like confirmation bias. Aha, you know, I'm going to share this map on Facebook because it agrees exactly with what I think, right? Clustering illusion, contrast effects, framing effects. These are all forms of cognitive bias that start muddling the message and can be misinterpreted. So the way we need to avoid that is determine the purpose of a map and its desired use, employ the standards that I just talked about, and then ensure that the intended message is transmitted. Remember, cartographic conventions are out there. There are norms. It's not a one-size-fits-all thing either. We have to adjust products for cultural conventions and how these things move around on a global basis. And just as a quick example, I'll show next slide, please. Here are two different maps. The one on the left is showing exactly the same data as the one on the right. From a cartographic perspective, the map at left uses nice, cool blue tone colors. You know, the dark blue, it's not too alarming. COVID's not a really big deal, right? That map soothes me. Look over on the right side, we have red color ramp showing where things are accelerating, and yellow outlines on hotspots and things like that. So it's very important. You get two different messages using exactly the same data. We need to understand that cognitive bias in the map creator, these guys may have had different intents when they selected the color palettes used, and how they're interpreted by the user may be two very different things. So cognitive bias and how we create cartographic products from space-based information is terribly, terribly important. Next slide, please. Lastly, I wanted to speak to the interdependencies of critical infrastructures. The healthcare system is but one element in a very complex web of interdependent critical infrastructures. For example, if the electric power goes out, the hospital may have a generator, but that generator will only function as long as it has fuel. So now the hospital is dependent upon electric power. Its backup is a generator, which is dependent on a transportation network to get fuel to the generator should it go out. And that may be dependent upon other elements of transportation systems. These things can be very, very complicated quickly. What we can do, and this was shown in part by the Copernicus presentation, is start using satellite imagery to analyze what's happening upstream and downstream in terms of the web of critical infrastructure that may be potentially affected. We're seeing this already here in the US with outbreaks of illness around meat packing plants. These are observable through satellite imagery, and we're starting to see it in terms of cost in the grocery store. Next slide, please. So what we can do is start thinking about and asking simple questions like, how is illness going to affect the food supply? Well, we can use space-based imaging to assess the quantity of agronomic crops planted and their condition throughout the growing season here in the Mississippi Delta where I live. Fortunately, the case counts hasn't reached into the agricultural community very high, and we should be able to see at least crops starting to grow in the next couple of months. But then disease may or may not progress, and we need to be able to monitor a farmer's ability to keep those crops healthy. So there are measures that we can do from space based on what's called the normalized difference of vegetation index and related techniques that can give us a very quick snapshot about crop health. So we want to ask the question, where in the past have crops been grown? Where are they being grown now? And what is their health? These are all fairly easy questions to answer using satellite imagery and allied space-based technologies. Another example, again, leaning on the interconnectedness of things, it's great if we have the crops produced, but now we need to move it after it's been harvested. So we need to look at things like number of parked aircraft, trucks, and trains compared to normal. We have lots of historic imagery that is available through many, many libraries, and we can do these comparisons to see, okay, the freight yard is full because the trains aren't going down the track, nobody's there to drive them. We can ask questions about how illness might affect energy. Anybody that's driven by a large power plant may have, unfortunately, have noticed massive piles of coal, or you can see activity at refineries and things like that. These are all observable phenomena that can be measured and understood at the user level. In fact, one of the easiest analysis that I've done locally is to look at the number of cars parked in healthcare facility parking lots. That's a very good indicator of the amount of capacity that's being used in that particular medical facility. Simply count cars in a parking lot. So the big idea here, to close it all down, is that we need to create some standards about how we're communicating and sharing the COVID data. Think about how we're presenting it to the decision makers or the intended audience, and make sure we're telling an integrated story using standards without bias to address upstream and downstream effects of the illness itself. That's my story, and I thank you for your time.
Thank you very much for this interesting overview. I think it was a great reminder on the various issues which come across when we are trying to use satellite data and image interpretation for globally addressing a challenge. As a next example, I would like to ask Astrid from the European Commission to give us a bit of an overview of the Copernicus services in support of COVID-19. And I believe everything which we heard now from Professor Brooks feeds also into the considerations of the Copernicus services, and also what we have heard in the beginning from Dr. Geissbühler, what is done on the international level when it comes to data and interoperability of data, and so on and so forth. Astrid, the floor is yours.
Thank you so much for having me. I'm Astrid Koch. I am representing the European Commission. We are the program manager of the Copernicus program, and the Copernicus data and services are free, full, and openly available for everyone to use. So the products I'm now showcasing are also available to the community here. So feel free to use it. So this is a short presentation of the operational products developed by the Copernicus Atmosphere Monitoring Service CAMS and the Copernicus Climate Change Service C3S for making informed decision. Both services are implementing by the European Center for Medium-Range Weather Forecast, ECMWF. And I would like to ask you for the next slide, please. The European Commission has a dedicated website on the initiatives launched by the Commission and its partners, and you can please look at this after the webinar today to have a look at all the different initiatives of the European Commission and its partners. So CAMS is monitoring air quality in Europe using Sentinel satellites, ground-based observations, and advanced numerical models. So because of the COVID crisis, there is increased interest in air quality. And as you know, the air quality is partly determined by the emission of the pollutants. So CAMS is an operational program. So we are doing NO2 forecast and particulate matter, looking at the different scenarios, doing forecast under normal circumstances you see on the left, then also on forecast for emissions reduced based on the restriction measures in place in Europe, and you see a visual graph for the difference of the two. And it's clear that there is a difference in emissions due to the COVID-19 crisis. So next slide, please. here you see on top the a dedicated website of the Atmosphere Service dedicated to COVID-19. And it's important, we are humans are very visual, so there is a lot of graphical products, maps and animations on the latest situation in Europe for you to look at and use. And as I just said, there is the forecast model estimate of the reduction in air pollution as expected on a daily basis. So they're daily forecast. On the right, you see a long-term time series looking at the air pollution across Europe. The green line, no, sorry, the red line is the daily mean of the current pollution of NO2. Here you see for Turin, and the dotted line is the 7-day mean. And this is compared to the CAMS reanalysis for the years 2017 to 19. That's the gray shaded area. And you can also, by comparing the surface measurements and satellite measurements from the Sentinel-5P tropomi instrument, whether they're consistent, and you see a trend. Here you see the red line and the black line. CAMS is currently also supporting a number of epidemiological studies trying to evaluate the links between air pollution and COVID-19, especially when you look at the fine particulate matter, whether it's a potential vector or not, and to see long and short-term exposure. So next slide, please. Just an example, here you see the NO2 total column for the mid-March to mid-April 2019 versus the same period 2020, and you clearly can see it's a visual that there is a reduction in emissions. This is done based on a Sentinel-5P, and it's providing grid measurements of air quality. You see down example over the United States. Just a matter of caution here, because you need to make sure that you use the right filters. If you look at pixels with clouds, you might not get the right results readings. So on the left, you see the one with appropriate filtering out the clouds, because you the atmosphere below the cloud you will not measure, and on the right you see when you're not having the clouds filtered. So just as a reminder to use the correct data. And next slide, please. And now I'm going to talk just briefly about the climate change service, which helps to support health experts to explore how temperature and humidity affect the virus spread. There was an application developed to map the mortality against temperature and humidity data. That is also available for you to use. We are constantly striving to make the products better. So C3S has been working together with the Atmosphere Monitoring Service to add new layers in the app to relate the emissions of NO2 and PM10. This has been done to provide the health community with the tools required to analyze existing claims, which links between pollution and the COVID-19 outbreak. So this was just a short overview of the two Copernicus services products for COVID-19. Thank you very much for your attention.
Thank you very much, Astrid, for this presentation of very specific products and what space technology can do, and also in combination with the presentation from Mr. Brooks, to highlight also how important it is to look at which data is presented, how data is presented, and how data is interoperable. So that's a very interesting next step following Professor Brooks' presentation. As a last presenter within this session, I kindly ask Rhiannan Price from Maxar to give us a bit of an overview of imagery and Earth intelligence for crisis response. Rhiannan, the floor is yours. Can you hear us, Rhiannan? Well, just to until maybe Rhiannan is connected to us, I just look at the questions and what we have seen previously in the exchanges on the chat, and I copied and I followed the questions, and I see that many of the questions have already been answered by one or the other presenters. I just wanted to pick out mainly two different questions. So one of the questions was focusing on how, if space data and if space technology can support responses to the COVID-19 challenges, especially for developing countries. How can these data be obtained, and how can these satellite images be used? So I guess this would have been a question for Astrid or for Lucia, and I would ask maybe we answer this question, and if Rhiannan is now then connected, we then follow up with the presentation. Is this okay?
Okay. Can I provide the feedback on the question? Lucia
yes,
speaking.
Please.
Okay.
Please, yes.
Okay. I showed some example from the Copernicus EMS rapid mapping service. It means that if the authorized user trigger the service, basically can receive directly the product, so the analysis, not the satellite images. Okay, there is also the possibility to access to the satellite images through the European Space Agency, but basically we provide the added value. For sure, in this situation, one information that we could provide is the detailed position, the size of informal settlement. This information could be very useful to understand the population density and to plan a specific mission for logistics and so. So when there are this situation over developing country, basically also the possibility to have in a short time the detailed cartographic product with the informal settlements. It's very useful to plan activities in the field.
Great, thank you. And I also see that Astrid has shared the link for the free available data of the Copernicus service. And I hope that answers the question of Daniel. I also see one of the questions was addressed during the presentation of Hagen, of Professor Hagen. And it was mainly addressing, can we have any mobile phone applications, GPS applications, to follow COVID-19 patients, despite the phone might be off? So the question was very specifically on technology, whether we can follow mobile phone applications and GPS applications, even if the mobile phone is off.
Hi, this is Jim. I wish I were a telecommunications expert, and that has to do specifically with the phone is off, whether it's truly powered down versus not on. I mean, that's part of the question, I think, is whether it's truly powered down. There's probably little that can be done. I would ask perhaps Professor Brooks, would you know anything about that?
Yeah, I think you have it exactly right. At least with 911 systems, if the telephone is completely powered down, there's no GPS signal and it cannot be pinged. If it's turned off and in some type of standby mode, like when you're charging, then it's easier to ping it. But be aware, this gets into some really dicey territory with respect to privacy. If whether we like it or not, big companies are harvesting that location-based data and trying to anonymize it. But we walk a very slippery slope if we're now tracking somebody with a known disease and link their location to their phone, you know, were that data to not be correctly managed or fall into the wrong hands, people are afraid enough that it could generate some civil unrest and other problems.
Thank you very much for that. I see now Rhiannan is online again, and since we have advanced the question and answer session, I think we can go forward to the next part of this webinar. Rhiannan, would you can you hear us now? Unfortunately, there seems to be a problem with the connection. I see that you apparently your microphone might not work at this stage. Let's try to solve this in the meantime. And if I can ask Alberto to go on and go forward to give us a presentation of Galileo Green Lane, reducing the impact of COVID-19 in the transport and critical goods across the borders. Alberto, the floor is yours.
Hello, can you hear me?
Yes, we can hear you well.
Thank you. Sorry, Marcus. So thank you. Good afternoon, everyone. So as you introduced, Marcus, the idea will be to see also the way we can use space technologies not only to fight COVID, but also to mitigate or reduce the consequences that is affecting to other industrial areas. And I would like to speak today about the mobility problems. Next one, please. So as you know, in the European Union, we are composed by 27 countries. And for us, one of the main advantages is that we have free movement of peoples and goods along our internal borders. But not anymore. Not anymore because due to the pandemic, several member states has decided to close the borders with other member states or to impose new health screening control for further prevention of the spread of the COVID-19. So as you can imagine, this has created several kilometers of queuing in some of these internal borders and hours of waiting in some of them. So at the end, we suffer of delaying of deliveries of critical goods such as medicine and protection supplies. And for this, the Commission decided to issue some guidelines in order to ensure that at least there is a limit of 15 minutes as a maximum time to go through these border crossings that was so-called green lanes. So with this aim, the European GNSS agencies are representing is supporting the development of a mobile solution that is relying obviously on satellite positioning in order to support coordination between the borders authorities in the 187 border crossings that were identified as strategic corridors by the European Commission, as you can see in the map. As you can see, it's also border crossings for non-European Union countries, because we're speaking about the strategic corridor for Europe. We are developing this solution in partnership with Sixfold. That is a startup company that is providing real-time information on the logistics. And because it's our interest also to promote industrial competitiveness of European companies, in particular startups, and because we don't want to enter into a competitive market, we are a EU public body. And finally, you wanted to say that we have two interfaces tests, one for the border authorities and another one for the drivers. Drivers means truck drivers or passenger cars, so it's valid for both. and it's available in the Android App Store, so you can download it, and but it's under pilot testing. So yet we don't have the version for iOS, but it will arrive very soon. Next one, please. So very briefly, I will introduce the two interfaces. First one, the one we designed for the border authorities. As you can see, it just provides real-time visualization on the overall situation in the country. The authorities, they can report on the waiting time in a very simple way. And they can anticipate also peak traffic patterns, and another possibility that we would like to do is to crowdsource the information that they may have also internally from additional sources. There is the case, for example, in Czech Republic, that they have a satellite navigation system for tolling, a GNSS-based tolling system, and one of the things they're doing is to get information from the onboard units in order to see the situation on the border. So this information will be also crowdsourced. We initiate testing with Czech Republic, I mentioned already, with Hungary, and now we start also from yesterday we started Spain, and Greece, France, and Romania, they will start next week for sure. So far, we received more than 5,000 inputs from the borders that are representing a good sample in order to evaluate the testing. And we can say that, anticipate to you, because now I will introduce the interface for the drivers. There is kind of 70% coherence on the inputs from the border authorities and the inputs from the drivers. Next one, please. So the driver interface that we are using also to validate the information of the officials is updating the map automatically. In this case, there is no manipulation, obviously, because the drivers are driving and they are not supposed to use the smartphones. But we are also trying to preserve privacy, because we are tracking only when they are approaching to the geofence area with respect to the border, that is a matter of few kilometers. Before that distance, there is no tracking at all, and there is no information that is sent to the server. In only 2 weeks that is operational, we got more than 2,000 downloads. We received this morning information about the border crossings, and we already achieved 97 different border crossings in 26 countries, meaning 50% of the target crossings that we consider strategic in Europe. And I would like to stress here as well that we are collaborating with the International Road Transport Union in order to prepare seminars for the truck driver associations in Europe, and to disseminate the use of this tool. Next one, please. So finally, once we get the information from the officials, from the border, from the truck drivers as well, everything is crowdsourced, also from other sources in the Sixfold platform that I already introduced before. And in this platform, you can visualize in real time how is the status in all the border crossings in Europe, not only the distance of the queue, but also the time that you're supposed to wait. And with this information, we are providing also some analytics, some reporting tools that are serving for the European Commission to understand what's the situation, how is the trend in the different border crossing with travels, and also to take actions on how to stabilize the situation. Next one, please. Okay, so this was one example we are designing for mobility in order to fight against the pandemic. But I will invite you to check out the catalog of worldwide GNSS applications that are all around the world trying to make a response to COVID-19. And here I leave you the link, so feel free to have a look. And otherwise, I'm waiting for your questions at the end of the session. Thank you.
Thank you very much, Alberto. Let's give it a try again with Rhiannan to see whether now the microphone works on her side. I would suggest that we move on now, go through this presentation, and we try to connect Rhiannan at the end of this session again. Let's try to find a way to troubleshoot it in parallel. My next speaker is from NASA, the program manager, Mr. John Haynes. The floor is yours.
Thank you so much, Marcus, and thank you so much to the UN Office of Outer Space Affairs for sponsoring this webinar and inviting me to speak to you today. I was waiting for the slides to come up. So as Marcus said, I'm John Haynes. I'm Program Manager of Health and Air Quality Applications in the NASA Earth Science Division at NASA headquarters in Washington, D.C. And if we can go to the next slide, please. This image here shows where it all begins for NASA Earth Science. This is our fleet of over 20 satellites and sensors in low Earth orbit, continuously monitoring Earth's weather, climate, and environment for research and applications purposes. This fleet of satellites and sensors, including several sensors on board the International Space Station, represents an investment of $2 billion per year by the American government. And along with the invaluable contributions of our international partners, denoted by the flags by each mission, this represents the largest Earth remote sensing civilian constellation in the world. Every day, terabytes of data are downloaded to ground stations in the United States, and this data is comprehensive of all types of environmental parameters of how the Earth system is dynamically changing. And the good thing about it is all the data is free. It is free to users across the globe at earthdata.nasa.gov. When we're talking about this constellation of satellites and sensors that are continuously monitoring our Earth, two, when we're dealing with the issue of air quality, are really the workhorses of the constellation. One is MODIS, the Moderate Resolution Imaging Spectroradiometer. MODIS is located on both our Terra and Aqua flagship satellites. MODIS, as I said, is a workhorse because it looks at the Earth in over 30 different wavelengths of the electromagnetic spectrum, giving us everything from the visible spectrum to the infrared. MODIS gets us a ton of information about ocean surface temperature, land surface temperature, vegetation density, and land use, land cover, and how that is changing, as well as with location of wildfires. But when we're talking about the issue of air quality, MODIS has a product known as aerosol optical depth, which is a product that measures the columnar load of aerosols in the atmosphere. And we can use this as a proxy for particulate matter 2.5 micron at the surface. PM 2.5 is a dangerous pollutant that, due to its small size of the particles, gets very deep inside the lungs, causing inflammatory responses and damage to the circulatory and respiratory system. Another instrument that is very important when we're looking at air quality globally is the ozone monitoring instrument, OMI, which is located on our flagship ARA spacecraft. OMI is an international contribution from the Netherlands and Finland. As its name suggests, OMI does monitor ozone globally, but it also looks at several other criteria pollutants, including nitrogen dioxide, NO2, and sulfur dioxide, SO2. So let's go to the next slide and actually look at some data from OMI. As I mentioned, nitrogen dioxide, which OMI measures, is a pollutant that is unhealthy to breathe and contributes to the formation of unhealthy levels of surface ozone pollution. NO2 primarily is emitted from tailpipes and smokestacks and also biomass burning. The ozone monitoring instrument, OMI on ARA, as well as the European Space Agency's TROPOMI sensor, monitor NO2 concentrations worldwide. And they've been showing large decreases of nitrogen dioxide in areas where COVID-19 mitigation measures have been introduced. As you can see to the figure to the right, this is an image of the northeastern United States centered on the New York City metropolitan area, showing the difference of NO2 concentrations from the 4-year March 2015 to 2019 average to currently, well, last month, March 2020. And that shows the large decreases in NO2 that occurred due to the terrible economic price of COVID-19 mitigation efforts, the lockdowns and so forth, that were put into place across the United States in order to slow the spread of the virus. These ongoing observations of air quality have provided immediate examples of how the Earth system is responding to these drastic changes in human behavior. The NASA OMI team has now created a portal to provide scientists an easy way to see how satellite nitrogen dioxide has changed in 2020 compared to the 4-year average of 2015 to 2019. And the link to that portal is located on this slide. I will also mention that NASA the European Space Agency, and the Japanese Space Agency, JAXA, are currently working to develop a COVID-19 dashboard, a tri-agency COVID-19 dashboard that will contain many environmental factors as well as socioeconomic data factors in the dashboard. This portal will be part of the dashboard that we hope to launch next month. Let's go to the next slide. As I mentioned, the current Earth system constellation is the most robust of any one across the globe. However, satellites, A, don't last forever, and B, we're always making new advances in how to measure the Earth system. So when we're talking about the issue of air quality, we at NASA, along with our international partners, are looking extremely forward to this instrument, TEMPO, Tropospheric Emissions Monitoring of Pollution. TEMPO will be our first air quality satellite in geostationary orbit. It will continuously stare at greater North America, providing observations of air quality hour by hour in the daylight. These will be observations of ozone, nitrogen dioxide, and formaldehyde. But TEMPO will not be by itself. TEMPO is going to be one part of a global air quality constellation in geostationary orbit, along with our partners in Europe with Copernicus Sentinel-4 that will be taking similar measurements across Europe and North Africa, and with our Korean partners and their GEMS satellite that launched actually earlier this year in February and will be taking similar measurements across East Asia. This unprecedented international air quality constellation will give us the ability to see how air quality changes across the entire Northern Hemisphere, not only as a diurnal cycle, but how air quality pollutants are transported across the hemisphere. In the United States, our Environmental Protection Agency and the National Oceanic and Atmospheric Administration are partners in this mission. The TEMPO instrument is already completed. It was delivered to NASA in 2018. It's just waiting on a launch vehicle, which has been confirmed for launch in 2022. And for more information, you can visit the TEMPO website located at the bottom of the slide. And I guess we can go to the next slide, and I will just wrap up here. And again, thank you for your time and attention. If you would like more information about our Health and Air Quality Applications program at NASA, I invite you to visit our website at appliedsciences.nasa.gov. Thank you so much.
Thank you very much. Thank you very much for this overview and for this presentation from the NASA side. We have now following up with another NASA presentation from Helen Chapman, using Earth observation to strengthen One Health collaboration. So this brings us very much back to the topic which we have started off today in the morning before the session, when our director mentioned the importance of partnership, networking, and cooperation. So Helen, the floor is yours.
Can you hear me?
I can hear you well, yes.
Wonderful. Thank you. Well, as my slides are pulling up, as John mentioned, I'm honored to serve as a panelist on this webinar session and present a brief presentation about the use of Earth observations to strengthen One Health applications. And we can go to the next slide. When we think about the global ecosystem, we realize that the health environments are essential to maintain the balance of environments collectively shared by humans, animals, and plants. The global burden is evident when there is an imbalance. For example, the WHO global estimates report that 12.6 million deaths are associated with residing or working in unhealthy environments. Of those, 6.5 million deaths are attributed to air pollution. Additionally, 96 million cases and 700,000 deaths are linked to vector-borne disease transmission, which accumulates about 20% of all infectious diseases. For this reason, we must seek innovative approaches to be able to contribute significantly to scientific advancement. Next slide, please. And modeling this is the One Health concept. The One Health concept incorporates two main elements. First, it describes the interconnectedness of humans, animals, and the environment, highlighting that the global ecosystem is interrelated. Second, it promotes the use of transdisciplinary collaborations to address complex global challenges, such as air pollution, antimicrobial resistance, and potential zoonotic spillover, and develop innovative interventions to mitigate risk. Using this framework, we can foster teamwork, strengthen communication across sectors, enhance disease surveillance programs, and increase public awareness through educational outreach activities. We've seen that in the presentations up to now. This can also assist our efforts to work locally with Ministry of Health objectives and internationally with the Sustainable Development Goals. especially as we train the global health workforce to be prepared to meet emerging One Health threats of the future. Next slide, please. Now that we've seen an air quality example in the previous presentation, let's examine another One Health application, malaria. Malaria is the third leading cause of mortality by an infectious agent, followed by tuberculosis as the first and HIV and AIDS-related conditions as the second. Mosquito breeding sites are favored by certain environmental factors such as temperature, precipitation, humidity, and land cover. In this project, researchers used satellite data and ground-based data to develop a malaria early warning system in the Peruvian Amazon region. If you could click once more for the video. So as that's going, in the project, the NASA land data assimilation system datasets, including hydrology data, were combined with the public health data to identify malaria hotspots in the Peruvian Amazonian region. Researchers also developed a regional model using population estimates and an agent-based model observing the behaviors of mosquitoes, Plasmodium parasites, and humans. Through this malaria early warning system, scientists integrated these data sources and validated ground-based data, which helped in predicting malaria outbreaks weeks ahead of time. As such, these types of applications have the potential to inform health decision-making, which has led to the aid of allocating prompt and appropriate public health resources to high-risk communities for malaria. These resources include coordinating vector surveillance programs, clinical management supplies for clinical care, health promotion activities, as well as capacity building. The next slide, please. In addition to using innovation to improve communication and information sharing, the One Health concept promotes transdisciplinary collaborations to strengthen scientific discovery. One example of this is the Group on Earth Observations Health Community Practice, which is co-chaired by John Haynes, representing NASA, and Julie Tartan, representing NOAA. This global network of scientists, researchers, and practitioners use Earth observation data to improve health decision-making across sectors and diverse geographic regions. This community practice aims to build new and strengthen existing collaborations with end user communities and identify gaps to highlight future research and practice activities. To address these efforts, 7 work groups have been formed to facilitate collaborations across disciplines on specific topics, including heat, infectious diseases, air quality, and food security and safety. Notably, over the past 2 months, the group has coordinated weekly teleconferences to foster dialogue about using Earth observations for COVID-19 response efforts, such as identifying environmental parameters that influence COVID-19 spread. Summary notes and slide presentations are available on the below link, www.geohealthcop.org. The group will facilitate the GEO community response to the COVID-19 pandemic session at the GEO Virtual Symposium in mid-June 2020, which aims to highlight how we continue to work together to develop and share Earth observation data, tools, and knowledge to support countries facing this global challenge. In closing, multi-sectoral, transdisciplinary collaborations can lead scientists and community practitioners to identify risk factors and develop innovative approaches and interventions for societal benefits. Earth observation data serve as innovative data sources that can link Earth and health scientists to collaborate on complex global challenges that affect the aquatic, atmospheric, and terrestrial ecosystems. We've seen this today through the presentations in this session. Through these One Health collaborations, shared expertise and learning can result in the development of prompt and appropriate environmental health applications to safeguard population health. And I thank you for this opportunity to be included in this session for today.
Thank you very much, Helena. Thank you very much for this overview. It was a good summary of the previous presentations. In the interest of time, and I know that Leon has to leave to another meeting afterwards, I would like to give the floor to Leon to present the VITAL project, which some of you might have heard already on the news. So the floor is yours.
Thank you, Marcus, very much. Can you hear me okay?
I can hear you well. Thank you very much.
Thank you. First of all, thank you very much for inviting me and for accommodating my schedule. Can you hear me okay?
Very well, yes.
Thank you. And I appreciate being just after my colleague here from NASA, Helena, talking about innovation, and which kind of applies to this project here. I will be representing the what we call the vital ventilator team from JPL. If you can go to the next slide, please. So in a way, in summary, we have put together in the last 2 months a brand new ventilator that is designed to address the current COVID-19 crisis around the world. And just to give you an example, this project is actually less than 2 months old. We started the project kickoff on March 16th. Today is May 14th. I personally was contacted by 2 engineers, David Van Buren and Robert Manning, who were talking in the cafeteria. And at that time, there was a real lot of press about the shortage of ventilators that people needed desperately. We were hearing about the crisis in Italy and some of the decisions that were being made for lack of ventilators. And so the idea was, why can't we engineers put together something real quickly? And the original notion was to make it open source, to make it so that you can go to a Home Depot or some equivalent, get some quick material together and make this available to everybody who may need it. And that was the original kind of vision. Let's do something quickly and put something together. As we started this project, the project actually morphed quite a bit from day one. And I'll go through a little bit of the steps that we took in doing so. But to jump to the end, we have received FDA approval for emergency use authorization, and we're now in the process of issuing global worldwide licenses for the technology transfer of this technology to manufacturing. So let's go to the next slide, please. So just as an introduction, JPL is a NASA center. It is the only federally funded research and development center in the NASA family. It is managed by Caltech. And we're better known for, repeatedly landing on Mars and doing a space exploration at Jupiter and across the solar system. We're not known, and rightfully so, for any design of any medical devices. So we are totally out of our comfort zone when it comes to medical devices. But we were inspired by this crisis, and we were challenged by the fact that there could be a simple, a straightforward engineering challenge, and that maybe we can make a contribution to. So the way we started this is that we immediately engaged the experts. So we went to Huntington Hospital, which is here in Pasadena. We met with Dr. Michael Gurevich, who is a pulmonary expert, a clinician, and treats patients in the ICU. And he came to us and he literally gave us a 101 kind of overview of how ventilators work, how the lungs work. And we were like kids in a classroom trying to understand what is it that really needs to be developed in order to treat these patients. So as it's indicated here in 37 days to be precise, we developed several prototypes, first breadboards, then prototype. Most people, 90% of us, worked from home. I haven't more or less left my home in the last 2 months. And we also engaged outside partners. In particular, we wanted to help patients and doctors at Mount Sinai Hospital in New York City, which at the time was the front line of the epidemic in the United States. And as you'll see later, we already received FDA approval. Next slide, please. So what was our strategy? As we knew very well that we're not going to compete or interfere with the Electronic was one of our key advisors in this design. We also partnered with, as I mentioned, industry. I reached out immediately to the FDA. And we told them that in a very humble way, we're simply rocket scientists who have no idea what we're doing, but we want to solve a problem. And that worked with the FDA and others, and immediately got in touch with Dr. James Lee at the FDA, and we got their assistance from day one, and which was really good. Then we reached out to consultants and companies who are specializing in design for manufacturing, and we made a specific goal not to interfere with existing legacy ventilators. So as we looked at the supply chain, we stayed away from any device that was being used by existing ventilators. Next, please. So what are the key characteristics of this ventilator? So when we brought in the doctors who were telling us what they need, they kind of told us that they are looking at patients who need kind of what we call corner cases of where they need high concentrations of oxygen, they need higher pressure, they need a certain number of features. And just as JPL is a pretty big systems engineering house, we just invoked all our standard processes and how we do design. We just accelerated what we would normally do in maybe a few years. We did it in matters of weeks. So we started with a requirements document. We started with quality assurance, processes, checks and balances, and a lot of design reviews, peer reviews, and so on. The number of parts that we're using here is considerably less than what a standard ventilator is. So it's complexity-wise, it's much simpler. Here it says 1/7. In fact, it's less than that. And it was focused on key design parameters like high pressure and patient assist. It is for intubated patients, so it's not a positive pressure mask. It is a fully intubated system, and specifically targeting COVID-19 patients. Next, please. And it was critical for us to test this at a hospital like Mount Sinai, in particular places that had very high-end lung simulators. So 2 weeks ago, we tested it at Mount Sinai Hospital, actually April 21st. On April 22nd, we submitted for FDA approval. On April 24th, we issued a worldwide royalty-free license. April 27th, we had responses pouring in from around the world. April 30th, we got the FDA approval for emergency use. Also, we demonstrated on April 24th this device at the White House with President Trump and at NASA headquarters. So it was a lot of press involved in the last couple of weeks. Next slide. So let me tell you where we are now. I just have one or two more slides. Currently, we've received just over, in fact, over 90 proposals for a free license of this technology. I have to share with you that in Caltech history, and Caltech owns all of JPL IP, they have never seen anything of this scale. If a technology has one or two, maybe three or four licensing requests, that is considered a major success. When we issued this call worldwide and received not just close to 300 registered applicants, but 90 proposals. And let's go to the next slide. You'll see the interesting thing. About 50% of these proposals are from the United States of America, and the other 50% are worldwide. Most notably, we had lots of requests from India and Brazil, which stand out relative to any other country request. But you see here on the right-hand side, all the countries that have requested, companies that requested license from those countries. And frankly, we're very proud that this is now reaching around the world. And you can see, including the Middle East, including Asia, Australia, Indonesia, certainly India and New Zealand, and so on and so on. So we're very proud to be doing this. We are evaluating the international proposals today and tomorrow, and we plan to issue the US license awards on May 21st, and the international ones on May 28th. So that's very, very fast. Next slide, I think, is my last slide. This is just to show a little bit the breakdown of who has responded. It's good to see, you know, that we have a diversity, medical manufacturers, aerospace, and so on, including manufacturing companies and so on. Most of the companies are small companies, which is interesting, but we're also looking at partnerships of companies as well. So let me just leave you with the last thought. We are still looking to issue these licenses broadly, internationally, and certainly could use any assistance in making kind of this broadly known fact. If anybody is interested in more information, I'm sorry it's not written here, but it's, if you go to MEDENG, or short for medical engineering, MEDENG.jpl.nasa.gov, you'll have much more information to review. And Marcus, with that, I thank you all for your attention, and that's all I had.
Thank you very much for the summary. Maybe
Hello?
you still have time before
Marcus,
you
hear
leave.
me?
You type in the commentary section the website you just mentioned. I just can't hear Rhiannan, so I guess this presentation will work right now as well.
Excellent. You can hear me?
Yes, I can hear you.
Wonderful. Yay. Thank you guys for bearing with me. I appreciate it.
So Ahmed, could you please bring up the perfect? Thank you very much.
Excellent. Thank you, guys. And thanks as well for everyone for your patience. As I was mentioning before, you know, Maxar is one of the leading providers of high resolution satellite imagery. And so what I wanted to share with you today are not only, you know, some of the, I'll say, use cases where a lot of our imagery and approaches have been applied to global health programs, but also how they're already being applied for the ongoing pandemic response. So with that, many of you already know, and if you're unfamiliar with Maxar technologies, we've gone through some rebranding. If you're familiar with Digital Globe, it's the same constellation. So we own and operate a constellation of sub-meter imaging Earth observation satellites. We're also, as many of you know, launching what we call kind of our next generation constellation, which is called Worldview Legion, which will increase our revisit rate over much of the globe, and all of that will also be a sub-meter resolution as well. So that's part of what we're kind of teeing up with some of these use cases that I want to share, particularly in terms of, you know, what can we do when we have more near real-time coverage from satellite imagery, especially at these types of resolutions. And now, of course, I will say, you know, taking a step back, you know, satellite imagery unto itself, as many of the previous speakers had said, is not a panacea by any means. And you'll see that, I would say that much more value is unlocked when you can use satellite imagery in conjunction with other geospatial data. There's just inherently much more value when you're using inherent ancillary data like that. But just to even start, some of the foundational questions that we've been answering and doing it at scale are questions like, where are remote populations, for instance, and being able to use things like whether it's crowdsourcing or artificial intelligence applications against imagery to actually map out where all of the remote populations are, you know, whether it's sub-Saharan Africa or South America or Southeast Asia, regardless where we are. And then, of course, the next question, right, is not just about where folks are living, but how do you actually reach them? Are there roads to get to these communities? Those are things that we can actually see in satellite imagery, and we can also start to understand, you know, what are the quality of those pathways, right? Are they paved or unpaved? Are they flooded in the rainy season? as well as, and I think this is mission critical in terms of what we've been seeing over the last few years here, is how quickly are populations growing? In urban areas, how quickly are we seeing horizontal growth and vertical growth, both things that we can see with satellite imagery. And then, of course, on top of some of these foundational questions, I'd say is, you can start to then further dig in on specific use cases. So one example would be, trying to understand, especially for, some of the most vulnerable populations, so refugees and internally displaced persons, IDPs, can we show where those folks are living, how many folks are being displaced, and how quickly camps and things like that are growing, things that are kind of readily used in satellite imagery that are even more relevant today in the pandemic response, as we know that especially these vulnerable populations, refugees, IDPs, folks living in informal settlements are not able to take the same measures that many of us can in other contexts. The safe social distancing is not nearly as possible. There might not be as much access to water and sanitation infrastructure and the like. So these are all also questions that can be helped and started to be answered by satellite imagery, as well as, I would say, all of these kind of questions that are further down the data value chain, so to speak, become really important, especially when you're starting to make decisions, right? And figure out, what are the scenarios and how can I plan and use geospatial information to make evidence-based decisions, which is really, I think, important, especially in a crisis where you have so many different stakeholders, oftentimes operating off the same data sets. I think satellite imagery can provide a consistent input to a lot of these questions too, across countries as well. With that, I wanted to show, with Maxar, we have, I think, a number of different approaches. We're for-profit companies, so we have a lot of what I would say are kind of commercial products and services, and what we call the human landscape is one example of that. Next, I want to really talk about some of the open data releases we've had, because I think this will be super important to this community. But to talk about human landscape and some of the data that we have been creating for the COVID-19 response in particular, I think this is a good example where, human landscape is us essentially taking dozens of publicly available sources, bringing them together, coalescing them, and improving them by not only validating them against the Maxar high resolution satellite imagery, but also enhancing those data sets where there might be gaps, or maybe where they're, in some cases out of date and we have more recent coverage. And so within that kind of quote unquote human landscape, I'd say there's a lot of data layers that are really valuable inputs for disease and population modeling to go, I think, very, very much hand in hand for a response like this. And so what we do, there we go. And so what we do, I'm going to take control. There we go. So what we do with that is we'll pull together all those layers. It'll feature things like where all the medical facilities, demographic details around ethnicity and population by age, population by socioeconomics, where are tourist attractions, something that's been really key, particularly in terms of enabling some of the policies that we've seen today. Where cultural points of interest that people might be, congregating, roads, things like that. So I think this is super helpful in terms of understanding, kind of having a comprehensive picture of all of the infrastructure and all of this data that are important to making more decisions down the way. And I'd also point out, kind of this blog post, I think, is a really good example of more detailed applications of data like this. So I'd encourage everybody to also check that out. And last but not least, can you do next slide for me? I'll take control again. Thank you. And last but not least, I really wanted to highlight the Open Data Program. So this is something, if you're familiar with Maxar's Open Data Program, we typically will release open imagery under an open non-commercial license, Creative Commons, for kind of pre and post-event imagery to support disaster response. Now, of course, that's the driving factor here is really supporting what I'd say humanitarian assistance, especially in kind of big events that have a very direct kind of loss impact in terms of loss of life or affecting communities. And so we wanted to be able to activate for the COVID-19 response as well. And so knowing that this is an entirely different beast than what we typically tackle with disaster response, we wanted to do an ongoing activation and are currently taking requests for more data to be released. And essentially just asking folks to let us know what is your use case, direct or indirect, as to why you need the imagery to support the response in the pandemic context, and we'll readily kind of release those data. We've got over, I think, 23 different areas of interest that are currently published and released that have been requests from a lot of our humanitarian and government partners. So please do check out this link, because a lot of the data are there. If you don't see data over an area that you're working in right now and you know it would be helpful, high resolution imagery data would be helpful for your analyses for what you're working on, please submit a request, and we'll get that hopefully published sooner than later. And there's been a ton of different ways that folks have been using this data, from, you know, a lot of it over our urban kind of metro areas. And so this is one example from the release that we did for Nairobi in Kenya. And so I, again, just kind of encourage everyone to check that out. And I'll say thank you again, everybody, for your patience, and hopefully the resources here are worth it. And thank you again to UNOOSA for organizing.
Thank you very much, Rhiannan, for it's great that you were able to present the Maxar's activities. I think with that, we have closed now the presentations, and in parallel I have been monitoring the chat function, and I didn't see much questions, and so I took the liberty and went through all your questions which you have submitted in the registration process. And I have to admit, I found out that not many of the questions haven't been addressed throughout the webinar now. So this is a clear reply from what I see, is that we have tried to give you the first overview of what's out there in terms of space technologies. So we have heard so many presentations on the one hand side from the research, from universities, the technical approach to what can actually be done with satellite technology, to real development from NASA in the ventilator project. So we have come from a very broad spectrum, opening up what member states are doing on the member state front, and we have landed now, closing up with Rhiannan's presentation on what satellite technology can do specifically. Just want to give you a reminder that we will have all the presentations on the UNOOSA website. We also will have the recording of the session on the UNOOSA website. Since there were no concrete presentations, and since there were no concrete questions, which we haven't received in the chat function, it's up to me now to close the webinar. We are over time already. I would like to thank all participants for contributing to this very shortly turnaround of this webinar. So we have done this within 10 days. It shows us, the great participation shows us that there's a real interest in the subject. I think the ball is now in our field to look whether we have the opportunity to go into more specific topics. We have now seen a very broad field of representation. So maybe we'll go in the next webinar in more specific topic area, and we invite you all to follow any news and any updates through the UNOOSA website. Piggybacking on what Rhiannan said before, I have put in the chat function a link to the UN Spider website, which has been mentioned by Radu in the opening. Please follow that. Here we put together any news of what space can do to combat COVID. As we have heard now, the space sector is a great example of industry and how transformative the sector can be, and how quickly adaptive the sector has been responding to what's happening in the world. So there's a clear call for international cooperation and coordination, and we as the Office for Outer Space Affairs obviously see ourselves as a platform to bring together the various stakeholders. We have seen so far great support for our different projects, and we will keep on trying to push this topic forward and how space technology can be used to combat our current challenges. Having said that, and since there's no outstanding question, I thank you all for participating. Unfortunately, we didn't go into the question and answer session due to the technical issues we had throughout the webinar. I'm sure the next webinar will provide us more opportunities for questions from the floor, and we have definitely learned our lessons today in the session of today in the morning, and we look forward to welcome you all to a next session soon. So thank you very much, and have a good evening, a good day, or a good lunchtime wherever you are at the moment. Thank you very much.
Thanks a lot, Markus.